Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. And if you're joining us right now, we are just getting our first conversation for this morning started. And as we said before the break, we are joined by the newly appointed Chief Executive Officer of the K.H.M.H.A Memorial Hospital, Chandra Nisbet-Cansino. Good morning.
Good morning Gavin, good morning Marlene, and good morning Belize.
And congratulations on your appointment.
Thank you very much.
Has it sunken in yet? How are you feeling right at this moment?
Every day, having to pass K.H.M.H.A to get here, it sunk in a little bit more every day. It sinks in a little bit more every day. I don't assume the position until October the 15th. But it feels like I have started already.
Yeah. And this is your introductory interview before you get your full investigation as to what's happening on the inside.
Yes.
But let me step back for a moment. You are well known in the country. You have been a political aspirant. You are outspoken social media activist, and of course professionally well known with your past roles. What prompted you to make the decision to even apply for this post?
Well, for me, Marlene, it has always been about service to my country. Even my little stint with politics, it was always because I wanted to serve the country. That didn't work out, and everything for a good reason. And so when I saw the opportunity, and then my passion is healthcare and healthcare provision and saving lives and all of that, simply because of my profession as a nurse. And so when I saw the opportunity at K.H.M.H.A, I decided, well, perhaps this is the opportunity that I may have been waiting for. So I submitted my application, and here I am today.
And the news was announced just a week ago, less than a week ago, and you have started to talk about what you are hoping to do when you go in. But just at the point of application and even through your interview process, there are conversations about goals and meeting the expectations and working along with the board. For you, in applying for this post, what did you want to do at the K.H.M.H.A?
Well, the vacancy ad came out, I don't remember exactly the date. And then I saw the chairman doing some rounds on the media, and I listened very carefully to him. He's the chairman, he represents the board vision. And when I realized what he was saying and what his vision for K.H.M.H.A was, then I realized that it aligned for what mine would have been as well. And so that is essentially what prompted me to submit my application for the position. And it's simply because K.H.M.H.A is 26 years old. And so it's at an age where, you're supposed to be going into adulthood, getting on your feet. It's time to reassess where you are in life, and I think that is exactly where K.H.M.H.A is at this point. It's a time to look at where K.H.M.H.A is 26 years ago. It was developed for certain service provision, and now that has expanded significantly, but the structure has not grown. K.H.M.H.A has remained the same size, and so space is a big issue. This board has a vision to increase the available options in size. They plan to build a new building. This current building is vulnerable to natural disasters, to hurricanes. I don't think it's able to withstand more than a Category 2. And so I think in the past it had to be evacuated. And so K.H.M.H.A needs a sound structure where patients can be safe in the event of a hurricane. There are plans to increase the services to be provided as well. I think Dr. Sosa had spoken about doing kidney transplants. And also improving the cardiac, the CAT lab, what we refer to as the CAT lab, which is where procedures are done life-saving procedures are done on the heart, where you don't need to be put under general anesthesia, etc. So increasing in size, increasing in service, and yet not increasing in the available space. So those are things that we need to look at for the future, for the medium and long term for K.H.M.H.A. In the short term, it is getting through this wave of the pandemic. Yes, COVID is here to stay, and we will have to work around that. But this current phase is really taking a toll on the staff. It's taking a toll on the hospital finances. It's taking a toll on the hospital supplies. It's taking a toll on the patients. And so we are really hoping that the current phase will not be lingering for much longer, so that we can start to heal. The staff can start to recover, as they really will need to recover after this, at least those that are in that particular unit. But there are a lot of support services that go along with that. It's not just the nurses and the doctors and the patients. You have the dietary, the kitchen, you have the maintenance staff, you have the cleaners, everybody. And so that group of persons, need to take their vacations, they need to recover, and then that would be the immediate attention that is needed.
Mental health too,
and
I
mental
hope.
health, yes.
It's interesting because your experience with K.H.M.H. is wide-ranging. You've sat on the board and you've worked there as a nurse as well. So you understand already going into this some of the predictable challenges. And one has always been, and I know we don't discuss it as often, is the status of K.H.M.H. It is a national referral hospital, but it is not a government hospital. And so while you may take very severe cases, what they call tertiary care, from some of the public clinics and hospitals, you are still with a subvention meant to earn for yourself. Now, that puts K.H.M.H. for a very long time in a very tricky predicament, because collecting on what is owed and even being able to keep costs at a reasonable place for the public is continuously a struggle to upkeep even the building, the staff, and everyone else. What are your thoughts on this, especially knowing the situation from the ground?
Certainly in that area, we will need to think outside of the box. K.H.M.H.A. has a $35 million outstanding debt from patients who have passed through the halls and haven't paid their hospital bills. It's not a free service, it's a tertiary institution, and it costs to run. Every single thing that is done for patient care has a cost, including human resources, oxygen, medication, surgery, operating theater, everything. And so I think Dr. Sosa, the chairman, spoke about looking at how we will handle that debt. That is one issue, but then you have the continuing issue. We don't want that debt to build, and we want to be able to put the hospital on a more sustainable path. And so those are some of the areas that we will really need to sit and strategize to see how we can work out payment plans with patients, devise ways to ensure that people are able to pay their bills, because the cost of the services is very reasonable. And you're getting the same services in a lot of cases that the private institutions get, because in a lot of cases it's the same physicians that are doing the procedures. And so I think we need to have a wide open communication with the public. The hospital is the last place you think of going, and so it's not something that people plan for. We have a very low percentage of our population that has health insurance, and so in a lot of cases when people become ill or they have an emergency, they really don't have any savings to sustain those types of tragedies or those types of illnesses. And so we have to engage the public, let them understand what healthcare costs, even go as far as promoting better lifestyles. So it's really going to be a culture change from the way people perceive K.H.M.H.A. and trying to establish more trust with the public, so that they are trusting that they are getting the best care, and what the care that we are giving is affordable, and that they can provide some sort of repayment.
And and with all that said, there's a whole lot that has to be accomplished, and several people would be sort of daunted, or so. Based on your past experience, made you feel ready to take on this sort of challenge, particularly at the time when we're experiencing the pandemic?
Yeah, people say you must say crazy.
Did you say yes?
I said, well, maybe. It took me a lot of thought. I had to think about it a lot. I had to discuss it with my family a lot. I had to pray. I prayed a lot because I didn't get to this decision without some guidance from the Almighty. And I just felt that it was my calling. I feel like I still have the energy. I feel like I still have the passion to do it. And when, as I said, I saw that the board's visions and the board's aspirations were aligned with mine, I figured, well, do or die. And so I am ready to take the challenge. I'm ready to give it 100%, 1000%, and hopefully have yield some positive results.
Yeah, I think Dr. Sosa said on our show that basically his vision is, or his selections for filling the main staff at the K.H.M.H. is for persons who won't come in with the mentality that this is Belize, and kind of elevating to another level. But you enter at a time where the institution is always at the center of controversy, and unfortunately so, because there are many success stories that come out of the K.H.M.H. We don't get to hear them as often, but we do hear about the raccoon in the accident and emergency. We do hear about collapsing roofs or people who pass away in the parking lot. Building that relationship with the public is a key part, so people know what to expect if they go in for an emergency or to access any service. What are your thoughts there, at least for now?
Yes, I agree 100% with you, Marlene, and that is another area that K.H.M.H. needs to improve on, because service and medical attention and nursing services, they're excellent at this time. I mean, you can't compare it to any other place. Yes, maybe I'm being a little bit biased. But it's our communication and accessibility to the public and by the public. And so we need to improve our customer service access. And so if a customer, it's not customers in this case, it's patients, have an issue, have a concern, or a relative they have somewhere to go quickly and get an answer immediately. Because I think that is part of the problem. People have, when someone is in a hospital, 99% of the time it's because they're ill. They have to have some procedure done. They have to recover from some illness, and so it's a very trying time for the patient and also for the family. And I think we tend to exclude the family, and really medicine is the care of patients and families, because the family might not be ill, but they are struggling to figure out how they're going to pay the bill. They're worried. They have a million questions that they want answered, and I think that is where the gap is, where you have the patient, and then you don't have that interaction with the patient and the family to be able to answer questions. So K.H.M.H. has to become more open in communication, more accessible to the public and by the public, and be able to provide that customer service without using the word customer. So that people are able, and yes, there is social media. People love to rant on social media. I have had some very, very interesting things said about me on social media, because it's an opportunity for you to be anonymous, for want of, but you would really prefer that somebody, before they went to social media, they had the opportunity to resolve the problem first. And so that is some of the areas that I think we need to improve on. How we treat people, and when I say people, I mean both patients and families, and how we are accessible by the patients and by families, so that they have an opportunity to resolve their issues. Sometimes it's just a simple question that they need answered, and that in a time when you're worried and your finances are on the line, it can really turn into something big, when it could probably be resolved right within the walls of the K.H.M.H.
What are some of the skill sets that you think you are bringing to the institution beyond your prior experience with the health K.H.M.H. itself?
Well, I am still currently employed with my employer, Social Security. I am ever so grateful for my experience that I have gained there, because I think that is going to help me a lot. As you know, currently we're dealing with customer care and customer service, and we have seen how important and how appreciative people are of being able to ask a question and get an answer, even if it's not the answer they want. People deserve the respect of a response. I've have the opportunity to work with policy. We need to review policies at the K.H.M.H., not only to write them or to review them, but to enforce them. Human resources is also an area that really needs a lot of support, and so there are vacancies in a lot of those positions that are currently being filled at the K.H.M.H. as well.
And in terms of some of what you want to accomplish, given all of even that what you mentioned just now, it's so multifaceted. Are there certain priority areas that you want to tackle immediately? And how do you prioritize based on the needs of the hospital?
Well, I am prioritizing a lot in my head. I haven't having the opportunity to get in there and review in any detail what the priorities might be as I move forward. I have a general idea. I've spoken to members of the board, and I know what their expectations are. And so I'll ask you to ask me that question like about maybe a few weeks from now. I would be able to give you precisely what the priorities are going forward.
Yeah, and I hear that from you. I was telling you that before we start. I hear you ensuring that you temper expectations until you've done your first assessment.
I know that I mean the institution is in a financial pickle as well, because the expenses due to the COVID pandemic have been wreaking. We are tripling the use of oxygen, tripling the use of the PPEs that the nurses have to wear, and all of those things, and we are not tripling the collections. And so we still have the same subvention from the government that we are trying to, or they are trying to stretch like chewing gum, in order to be able to be have enough oxygen, and so it's really a tough time, because expenses are increasing, but collections are not, and so that's one of the areas that we really have to look at.
On the area of the staffing at the K.H.M.H., are you planning to meet with the K.H.M.H.A union or the Nurses Association to get a feel of their perspective from the ground?
Most definitely. I plan to meet every single person that works at the K.H.M.H. It's almost 700 people. So I'll have 700 new friends. But definitely, the union is a very, very important partner. The Nurses Association, I think it's more the K.H.M.H. union that cover the workers of the K.H.M.H. The Nurses Association is more for the district hospitals, I believe. And so, yes, most definitely, I already got a text from the union asking when they will be able to meet. So definitely they are number one on the top of the list of groups of persons that I will be meeting with.
Well, they've had a tough time because of what we outlined before. They're not government workers, they're not public servants. They work with the K.H.M.H. They don't get the same benefits as public servants. And I know it's been a long, drawn out situation in trying to get the benefits that they feel that they deserve.
Yes, that's certainly one of the conversations. I think in one of the press releases, it seems that they are looking to have a seat at the table at the board level, and I think that would be very very beneficial for the partnership that is necessary when those decisions are made, so that you have buy-in at the top and at the beginning, and try to avoid as much controversy as possible.
Yeah, yeah. Now, looking at the referral system in place as well is also something that has been a challenge. The public naturally, in an emergency, wants to go to the K.H.M.H. Triaging is, as anyone would expect, very difficult. When you start to prioritize that Gavin is more sick than Marlene, so we'll see him first, even though he just come. That becomes an issue itself. And for a long time, the K.H.M.H. has been concerned that people don't use some of the other public clinics. Now, COVID changes the landscape for all of this, but when we do get over the pandemic, it will be a returning issue. What are some thoughts there?
Yes, it's certainly because of K.H.M.H.A Memorial Hospital falls within the health system of Belize, and so it's one of the dots on the map. And so usually for Belize City, it is the Belize City Hospital per se. So anytime there is an emergency or anytime somebody is ill that is from the Belize district, they go to K.H.M.H. And so the hospital services the entire Belize district. However, when you have persons that are ill and are at the regional hospitals, then they would go to their regional hospital. What does happen in some cases is that we get referrals to the K.H.M.H. that perhaps can be treated at the regional hospitals. Then again, that's a drain on our resources if those people are not able to, cover the expenses and then the regional hospitals don't have those expenses anymore. So I think it's the partnership with the Ministry of Health and Wellness is extremely important as well.
Yeah.
And so it will probably take some time, sit down with them, maybe look at ways how we can support each other, and be able to, because yes, in Belize you do have the health centers, Metro Nurse and the Cleopatra White. There is a triage nurse at the K.H.M.H. I think at this time it's only for quite a while now it has been only emergencies. So any non-emergency patient is referred to Cleopatra White or to Metro Roberts Health Center. But in a way, maybe it's a little bit of trust that they might have going to you have to look at it positively. And of course we want people to trust the K.H.M.H.A Memorial Hospital. And so yes, those are areas that we will have to sit down and partner with the persons who can help and support, because I think that is extremely important as well.
Yeah. When you heard the stories of the nurses in the COVID-19 unit, that would have been around the same time you were applying or interviewing, I believe. I know doing the interviews, it was a highly emotional interview. What were your thoughts? And knowing especially that you were hoping to take over the leadership, what were some of the things that you thought in that moment, I wish I could be the CEO so I can do X, Y, Z?
It was as emotional for me as it was for everybody else. I think that if they could only have more staff, if they could only have mandatory breaks, if they could only have additional somebody that will drop the food there so that they don't have to worry about making food in the morning and taking it. Things like that, I think, would simply because of the uniqueness of the pandemic situation, where you have to be in this specific type of PPEs. You can't be coming in and out, and so it's really a unique situation that I don't think, well, many people, but K.H.M.H.A has ever faced. And so I think for that group of persons, a little bit more support logistically, and more importantly, psychologically. I don't know what the situation is in regards to psychological support for those persons. I've already had persons reach out to me and said, if you need my help, I write down all of their name. Because I was really, I was very happy to know that a lot of persons are offering support, are offering help. And so I hope to tap into some of those when the time is right.
And the nursing shortage?
I think they have recruited some new nurses. I haven't gotten the final numbers, but I think that is being addressed now.
Do you know what the vaccination rate is for employees of K.H.M.H.?
No, I don't.
Okay.
No, I don't.
Because we know that with the new regulations, statutory bodies will be included as a part of the enhanced measures, that people must show proof of vaccination or a negative test.
Right.
If that's your first task to implement and you meet resistance, how do you imagine you'll handle that?
Well, thankfully there are regulations. I think first and foremost, I believe there's a fairly good uptake. I don't want to hazard a guess, but I think there's a fairly good uptake of vaccinations by the nurses and the doctors. The support services, I'm not too sure. But handling it would be simply following the regulations. You guys, and I think more importantly, trying to convince them to get vaccinated, because it's really the safest for them and for the patients. We recently lost the first nurse to COVID, and that that was not. I think Belize has done fairly well in regards to that statistic, but we wouldn't want to lose any at all, and we are already short of staff. I think we do have staff that have been becoming positive with the new variant as well, but thankfully so far, for the K.H.M.H, everybody has been okay. But first and foremost, to try to convince them to get vaccinated, and then otherwise enforcing the regulations, rotating persons that may need to be rotated, etc.
Do you envision in the long term, and I'm really pushing you here to think ahead, that there should be, at least from the outside looking in, some restructuring to what's happening to the structure of K.H.M.H.? In other words, as a statutory body relying on part subvention and part cost of care?
Well, ideally, the K.H.M.H would want to be as self-sustainable as possible. That, I think the chairman keeps saying that as well. That is really something that we will need to sit down and discuss, possibly establish partnerships with persons who can support, again, think out of the box, for fundraising and for collecting. Those are the things that I mean, a friend of mine shared a quote with me that stuck in my head, and it says that the true meaning of life is to plant trees under whose shade you will never sit. And I think that is how we need to look at the Carl H. Memorial, not as a 3-year contract that I will do this, but in the long-term vision, and to see 10 years from now, that it will be an institution that we can use the word excellent to describe.
And I suppose, I guess, how would you then define like that sort of excellence? If you could put it into in a nutshell and say that maybe one, let's say, positive change that you hope to accomplish.
That's a tough one, Gavin, because you want to improve service provision. You want to make the services available much better. Like Dr. said, Dr. Sosa mentioned, maybe going as far as doing the kidney transplants, improving in the cardiology unit, etc. So that would be one area. But then we also have the other area, which is having the financially sustainable institution. And so there are so many different moving parts of the hospital that it's hard to just define one. So it would probably have to be different, maybe like 3 or 4 different areas that we would have to zoom in on, as opposed to just one.
But is there anything that you think, I can't wait to have an impact in this area?
Probably the improvement in or the extension of services. I would love to see somebody in Belize get a kidney transplant. It's really a huge demand. But I would also want to see the staff be a little bit more, relaxed, improve the working environment in some areas. So it's hard to pick one, Marlene.
Okay, so let me ask you the other question, and this is very personal. Will you be an accessible CEO? Will we have to call the media, the public? Will we wait to see you on the rare occasion, or will the K.H.M.H. be more open-minded in its approach to the public?
No, definitely it will be much more open to the public. The gentleman who initiated that openness and communication for my current employment is sitting right here in this room, and I really learned a lot from that experience. That people simply want access. They simply want a response. They simply want to have their questions answered, and that is certainly one of the first things that we will be looking at, or that I will be looking at, to ensure that yes, we are more open. K.H.M.H.A Memorial Hospital is the people's hospital. It's not for me. It's not for the government. It's really for the people of Belize, and so they're entitled to have whatever information they need, financial, service. Whatever you need to know or want to know about the K.H.M.H.A, you should be able to know. Yes, there is a strict confidentiality protocol when it comes to patients. So you will never get a patient name from me. You will never. But information people want to know. I think there's a lot of questions about, who in the COVID unit. They have pre-existing conditions. Do they? How old are they? That sort of information the people want to know, and I think the public should have access to that sort of information. So yes, certainly you can expect a more open communication channels.
All right. And
I was going to ask one aspect which you touched on a little bit earlier, is dealing with sort of just the infrastructure of the hospital itself. Taki, and you had mentioned its preparedness for hurricanes, and Marlene had also mentioned some of the other pre-existing issues. How do you feel about tackling that particular aspect, because that also has a lot to do with the sustainability of the hospital as well?
Yes, I think the biggest challenge will be to source the funding. We have a maintenance and operations unit at K.H.M.H.A, very familiar with those processes. I think it was 2013 where they built the neonatal intensive care unit. That was when I was on the board. The process has been done before, but the challenge would probably be to source the funding and to be able to make the payments, and so I don't think that it is too big of a task that we would not be able to do it.
And what about things like, just lastly, triggered in my mind, what about things like residential programs? You have some GPs, general practitioners, who've been working in one unit for a long time. If they were at a training hospital, they would already be specialized.
Yes, that is an area that the board is also looking into. Precisely what you said, improving the residencies and the residency access to the K.H.M.H.A Memorial as a teaching hospital.
All right. Well, we are out of time, and this is only the introductory interview, but you can look right into that camera, because as you said, it is the people's hospital. And people want to hear from you, so you can share your closing thoughts with the public.
Well, I would just like to ask for persons to just bear a little bit of patience, and as we start the process of reviewing, and I always tell persons, any ideas you might have, any suggestions you might have, we are open to listening. That will be a large part of what I do initially. Will be to listen. Like I said, it's a large staff, a large group of persons. We want to hear from everyone. We can't do everything that everybody wants, but we are willing to listen, and make some positive changes, and improve the trust that people have, or that the people have with the K.H.M.H.A Memorial Hospital. Looking forward to those partnerships.
All right. Well, we plan to check back in with you and see how it's going. But thank you for coming in and having this first discussion with us.
Thank you so much for having me.
All right. With that, we're going to go ahead and take a break. When we come back, the focus will be on climate change. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.